Okay, and then on the topic of testing ticks for various infections, there's one recurrent controversy that comes up, and this would be on Bartonella. So Bartonella, known to be carried by fleas, which introduce the infection to animals like cats, which can then spread the disease to people. But it's debated whether or not that's the only way that people can get Bartonella infections. Now, back in 2004, a study from New Jersey found that over 30% of the ticks sampled carried Lyme disease as well as Bartonella species. And this is concerning because often I'll have patients that even if they knew they had a tick bite and maybe they got tested for Lyme disease, Anaplasma ehrlichia babesia, which are often tested within the ticks, or clinicians might be ordering, a person is very often not being tested for Bartonella. And there's a few of the labs that will test the ticks for the Bartonella. But we see research from not too long ago that the Bartonella is certainly out there. And direct proof of transmission of the Bartonella species by a tick was reported way back. I was talking almost 100 years ago. Experimental transmission of Bartonella to monkeys by Rocky Mountain wood ticks. In this study, ticks were allowed to feed on the infected monkeys for 5 days. After removal, partially engorged ticks were placed on healthy monkeys in which the disease developed. The study showed that ticks could acquire and transmit the bacteria. Much more recent studies have shown different types of ticks transmitting the Bartonella, which is the causative agent of cat scratch fever, through artificial feeding systems. So we know the Bartonella is around, and we know it's found in many ticks, and that the ticks can transmit disease, but it's just not often being tested for in people or in the ticks themselves. And at this writing, the CDC's official position is still to discourage the testing for Bartonella after a person is bit by a tick. So there's obviously much more to be said on this topic, but it is imperative that people take initiative and be their own advocates in healthcare. One of the reasons many people will turn towards naturopathic medicine is because naturopathic physicians often do try to get to the root cause of an illness.